So moving on to thinking about today's webinar, it is really important to work in partnership, and it's all about the safe care of women, babies and families. And as I said briefly before the housekeeping, it picks up on point 2 in the code, which is from the section on prioritising people, where it says listen to people and respond to their preferences and concerns. And what we're also doing as part of this work is thinking about reflecting and the importance of that in practice, and also using the resources that are available on our website. So we've got and have developed a care reflective tool, which the CARE acronym is for compassion, active listening, response and effectiveness. And that's thinking about things like how did you meet personal needs and build a relationship, actively listening to choices, what happened as a result of the what you heard and what you were told, and what's been the positive impact of your care. And we'll be hearing about that later on in the webinar. And there's also an element of what would you do differently next time. So for those of you who've been on the website and looked at the stories and looked at the care tool, you'll know what I'm talking about. But for those of you that haven't, this is the tool, which keeps going in and out because of my inability to load, but it's available to download. And we've also got a poster which talks about for every pregnancy and your midwifery team being there for you. So without further ado, I'm going to hand over to Jacqui, who's going to talk to both Sophie and Simone, and has a couple of questions that hopefully generate thoughts about what's happening and the best way of reflecting and listening and learning from that. So over to you, Jacqui.
Thank you, Verena. And I think what we really want to get out of this evening through Sophie and Simone's insights is about how partnership has made a difference to them. So Sophie, if I can start with you, because you had your heart set, I believe, on a home birth, and you'd weighed all your options up, hadn't you, with your midwife? But when it came to the day, staff shortages prevented you having that. But thanks to your midwife's efforts, you were still delighted that the team was able to replicate what you wanted and what your preferences were as closely as possible. And your midwife even thought about some home comforts, which perhaps helps your anxiety and made you feel generally overall good about the birth. So given that your exact preferences, Sophie, didn't work out as you'd planned them, how do you think partnership did work to make sure you had the best experience possible?
Yeah, so obviously, as you touched upon, Jacqui, I didn't get the home birth, understandably because of staffing, and I unfortunately also the birthing unit was shut due to staffing as well, so I kind of automatically went to the labour ward, and despite it not being my preference, the midwife made it as close to a homely environment as possible. So I was finding at home that using the birth ball was really helping me during my labour. So she went and sourced one of those from the birth unit. She was aware of my birth plan that I had asked for, dim lighting and kind of, setting the scene with candles, etc. So she went ahead and set that up for me. She also read my birth plan. That was probably one of the first things that she did, and kind of replicated that as closely as possible for me. And for me, what I really wanted from my labour was a quite hands-off approach, obviously within safety measures, her checking me and baby, and she definitely kind of adhered to that. There were also points during my labour where you know, my partner, for whatever reason, had to, you know, step out the room, so just, you know, use the toilets, etc. And she was really great at kind of taking over from him. So I found kind of pressure into my back really helped, and she was there to support me with that. And throughout my labour, she really reminded me of, you know, all the techniques that I wanted to use, like my breathing when she noticed that it was changing, kind of intervened when appropriate, but not too much. So I think, although it wasn't the place where I kind of preferentially wanted to give birth, the midwife really made the experience positive for me, despite it being in the labour unit. And also, not even just during my labour, but on the postnatal ward, it was during COVID when I gave birth, so my partner wasn't able to be there, and as in the postnatal ward, and they were aware of that, and I really wanted to get home quickly, and the midwives on the postnatal ward did all the checks really quickly, and helped me to be discharged kind of the same day. So I felt like, even though I was in hospital for the main event, actually it was a quick in and out that made my experience really positive.
Sounds like working as a team, even.
Yeah, definitely from start to finish. Yeah, I believe that they all worked really well as a team.
And Simone, you told us that throughout your pregnancies and the birth of your 3 children, you found that you could rely on your midwives to support you with the compassion and gave you the expert advice that you needed. And although, despite that you sadly had a miscarriage and one pregnancy you had group B strep, you did feel quite anxious with the pregnancy. So given the way you were feeling, why was that partnership working with your midwife so important to reassure you?
Yes, Jacqui, like you said, for me, it was really being able to share my anxieties with a professional, someone who was receptive to what I was saying and empathise with me, was able to give me the medical opinion as well as just seeming to take an interest in kind of what I was saying. And that really helped naturally bring down my natural anxiety levels, I would say. It was good to know that they were able to give me information, and I was able to relay that back to my husband at a later date, as he wasn't always able to make the sessions with me. So it was kind of no pressurizing of having to make decisions then and there, but I could go away, discuss it, and always come back and update them with information. So that really felt like everybody was included, everyone had a say, and that kind of really helped just bring the anxiety levels down a little bit.
And Simone, you said that they were receptive. Can you give us some examples of how you knew that they were being receptive to you and your worries or anxieties?
Yeah, I mean, just having a conversation, like woman to woman, just being able to literally have a conversation, them advising, you know, that they can understand why I may have been concerned. Also reassuring me that every pregnancy was different. And just because one thing had happened in one pregnancy didn't mean it was necessarily going to happen again in another pregnancy. So that and hearing that from a professional really sort of did help.
Yeah.
It really did. So for me, it was just having that dialogue back and forth, them letting me know where I could go, that I could contact them out of hours, you know, if needed, and the different departments within the midwifery care that I could go and talk to if I needed to. That really helped.
So just checking back with you, although you were having, you were on that journey with different pregnancies, they didn't say, oh, well, Simone's had 3 pregnancies, she knows it all. They were checking back and still checking your understanding and what you need, would you say?
Definitely. Yeah, definitely. And it was, I would say it was a true partnership. Definitely with my first is when I had the GBS. And from kind of the moment that I was told I had it, obviously I had my own anxieties about reading it, things you read, and just them advising me what would happen when I went into labour, and that translating with the midwives when I actually did go into labour. So I already had an idea of what was going to happen. I wasn't alarmed, and literally talking me through everything they were doing as they were doing it really helped.
Yeah,
really helped.
Yeah. Thank you. So I'll come back to you both in turn again. Thinking back, can you give me some examples of the things your midwives did? I know, Sophie, you've explored that a little bit, whether big or little, that made a real difference to the care you and your family received. Because sometimes it's not always something that's difficult, but it is some of these very, sometimes more easy things to do. So what would you say to that, Sophie?
Yeah, so as you said, it's actually sometimes the small things that actually make the biggest difference. I mean, during labour, things like words of affirmation and encouragement for me were huge. Obviously not intervening too much, but giving lots of encouragement, and also just making me aware of kind of how I was progressing, because I'd never done it before, and how I was managing and coping. And especially kind of, I appreciate that there are, as we're aware, always staffing shortages, and you've got, I'm sure, lots of women that you're attending to, but I never felt like that. I always felt as though the midwife that was there with me was there for me, rather than thinking, oh, I need to pop out to see somebody else because I've got another lady that's labouring as well, and that really helped me to feel just really reassured.
How does she do that, Sophie, would you say?
I guess just being present with me, and if I asked her something, she was there to answer it. If a couple of times my husband felt like somebody needed to come in, and being there kind of pretty much straight away. So that was kind of the main ways that helped. And yeah, not feeling like I was rushed at any point, feeling as though I could have the time that I needed with them, despite probably having somebody else that they needed to attend to as well.
And you said they use those words of affirmation. Can you remember any of those?
Oh, that's a good. Now you're testing me. I think just things like every contraction is like bringing you closer to your baby, like words, affirmations I put down on my birth plan, she was kind of taking on board and using, but the specific ones, it's a couple of years now, so I can't remember the specifics. And just one more thing, I've touched a lot on labour, but actually postnatally, one massive thing that I felt gave me so much confidence was at my day 5 check, I was breastfeeding. I'd never obviously done it before, didn't know if it was successful or what, and after my baby was weighed and he'd gained weight, the midwife was so reassuring and just kind of said to me, whatever you're doing, just continue. And that gave me just a huge boost, and reassurance that actually, I was doing the right thing. And it was so small, but it made such a difference to me in my journey of breastfeeding.
And Simone, same question for you. Thinking back, any examples of what the midwives specifically did, big or little, that made a difference to both you and your family?
A lot of it is kind of the stuff that Sophie's already said. Really feeling like you are the only one that's giving labour at the time when you know that you're not, and they've got plenty of other women that are being cared for. But the one who has been taking care of me, they just were really present the whole way through. Definitely with the first one, and not knowing sort of anything, and having the extra precautions of going on the drip and having antibiotics, them really talking me through what was happening, and that, it wasn't a big thing, it was just a precaution. That really helped, and explaining that not only to me as the one going through it, but also my husband, who was also in the room with me, and just reassuring him. I mean, with that pregnancy, that things sped up really quickly, and I had to, in the end, be moved from the birthing centre to the labour ward, and kind of just helping him to be okay with all the rushing around that was going on, as well as me. So that for me was a big thing. Him feeling included, and obviously it must be scary for your partner, seeing your wife in that sort of situation. Yeah. So that was a big thing for me. And also, I say with my last, having him in the birthing suite and knowing that I had to be moved to a side room, but them not rushing me not feeling rushed at all, but giving me and my husband time to bond with our son, that was really good for me. They had to do their checks, but they literally left him on me for as long as possible after he was born, being fed. And those little things really made a difference to me.
Yeah, and you can obviously remember them too. Yes.
Yeah.
And it's fantastic because we've got about 146, 147 people on the call, and that's a mixture of midwives and student midwives, so midwives of the future. I'll come to you, Sophie, first to say, have you got any tips for the midwives and the midwives of the future about how they can improve partnership working with women? And we must share with them something quite exciting, mustn't we, Sophie, that you're actually pregnant again, so you're coming through doing this all again. But any tips that you'd like to share?
Yeah, so as I've kind of touched upon, on the whole, I can't really fault what you guys do. It's incredible to support a lady through such an important point in her life. If I have kind of a couple of tips, so one which was really important to me, and I think is a really small thing that everyone can do, is just remembering that hello, my name is, and introducing yourself and who you are. So just spending 10 seconds saying, hi, my name is Sophie, I'm going to be your midwife for this shift, because that makes such a huge difference to actually how you feel, that who's in the room with you when you're at such a vulnerable point, and knowing what profession they are, because it's quite easy when you work in it to know, oh, this uniform means this, this uniform means this, but actually to someone who doesn't work in a hospital, uniforms mean nothing. So just telling your profession as well, because there were points where there was a doctor in the room and I didn't know who they were, and I would also say just be really mindful, I guess, of what you're saying in front of the labouring person, or the pregnant woman if it's antenatally, because it wasn't a midwife, but there was one point at which there was something discussed via a doctor whilst I was labouring, and it immediately, even though I was kind of in a world of my own, it immediately made me kind of worry. So if you need to have those discussions, I appreciate sometimes they have to be had in front of the lady, but if it's at all possible and isn't necessary to have them there, then maybe just being aware to kind of have them outside of the room, and that can make a big difference on how that person feels.
Absolutely. Simone, do you want to come in with any tips?
Like on that last point, like I said, with me, it was a case of having to be rushed from one place to the other, but just kind of communicating what was happening to the people and not kind of having discussions frantically amongst yourself as well. That helps people. I may have been out of it, but my husband would have been more aware of what was going on. So just kind of keeping the family in the loop as much as you can as to what's going on, so that people don't become very anxious and start worrying, sometimes unnecessarily. But even if not, just not adding that level of stuff onto the labouring woman, I think. Definitely. And just like antenatally as well, listening to any concerns that are being told to you, kind of not having a dismissive nature, or because you guys do an amazing job and get through so many ladies and probably hear a lot of the same sort of stuff coming through. And I think it's just very important to remember that everyone who's coming to you is coming as themselves, and not the maybe 600 women that you've seen prior having the same sort of worries or issues. So just really having that one-to-one support and actual interest in the person that you're tending to would be really important in my eyes.
Mm. Mm.
Just to touch on that point actually as well, one more thing I would also give a tip on is I don't know if you guys have the notes prior to kind of appointments antenatally, or if they're the only notes that we carry with us that you have, but if you do have access, just literally spending like a minute or two before that lady enters the room, just refreshing yourself, and especially if there are any concerns that lady had raised in the previous appointment, just checking in again, so that it feels personal as well, and actually, as you mentioned, obviously I'm expecting again, and the midwife that I had first time around, I'm now actually seeing again, and she remembered me, and even just something as simple as like, oh, you know, how are things going from before, and I remember you. That was really huge. But you know, yeah, checking notes if you can, just literally for a couple of minutes before, can make such a difference.
I think that will vary, Sophie, because obviously some places are still doing, but as we move more into an electronic system, there is the opportunity to do that. And yes, yeah. And I just really wanted to let you know that we've got a student midwife on the call who's already doing great work in terms of introducing herself. But importantly, when they go into the room, if there's things, and she tells them what year she is, and that she should be there to support throughout. And anything I don't know, I will find out. So it's having that confidence, and also explaining who actually enters the room. So the midwife or the student midwife being that sort of navigator, so people who don't sort of forget. So thanks for that, Hannah, because that's any other thoughts on that one? Tips about partnership working?
No, I think my last point was actually what Sophie said about trying to read the notes if you can beforehand, of the person that you're going to see. I mean, I was fortunate with my antenatal care that I think the majority of the time for all 3 pregnancies, I saw the same midwife. So that really helped build a rapport. I know that's not always possible, but that really does help build a good rapport with who you're seeing. Yeah.
And I understand, Sophie, that you've had that opportunity with this pregnancy to meet the same midwife again. So do you want to sort of share anything about how that partnership is going?
Yeah, definitely. I haven't had a huge amount of appointments yet, but yeah, I am still seeing the same midwife. Obviously prior pregnancy was during COVID, so it was obviously a bit different. But this time round, obviously getting a different kind of experience in that sense. But she's great. You know, can't fault her. Like I said, when I arrived, she said, "Oh, I think I've seen you before," and like, how are things going? You know, and just made it feel really personal, which I think is huge to me going through it again. Because as you touched upon, Simone, just because it's isn't necessarily your first pregnancy or second, you're still going through a pregnancy, which is, you know, brings a whole host of emotions and a whole host of worries. So I'm not taking that for granted. And you know, she still has given me exactly the same care as I had first time around, and not dismiss it at all that it's my second.
Okay. So if there isn't any final thoughts on that, I think I'll hand over to Verena to find out what questions are coming through. You're on mute, Verena.
Yes. How many years is it? And I still can't manage the mute button. But just to say, I think a lot of the points that you've made are coming through in the chat. And what I'll try and do is possibly theme them. But Jacqui's already mentioned about our student Hannah, who's very careful to explain time with the women in her families about who she is, what year student she is, and that she'll be there throughout, and anything that she doesn't know we'll find out, which ties in very nicely with what you were both talking about. And I think what was coming through both of your conversations with Jacqui was the thing about the importance of communication throughout, and listening, which goes back to our point about the code and that point about prioritizing people and listening to their preferences and their concerns. But what we've also got is a good point, which is around explaining who's coming into the room and who may come in, so that it's a sort of an anticipatory and not a surprise when various people come into the room. And I think that point about always remembering that sort of key phrase about, hello, my name is, because that sometimes gets forgotten. But we've got somebody who's raised the point, Hukma, about she's made the point about reminding people that she's a student and emphasizing that point, that if she doesn't know, she will go away and find out, which is great. And both of you have been asked, and Jacqui, it's this thing about the best place to have discussions, because the point's being made that if it's outside the room, then sometimes it can feel like, from Sophie and Simone's point of view, that you weren't included in the discussion and that sort of decision making. So I wonder what you sort of think about that from the point of view of both the sort of communication and the sort of team working, both across the professions, but also with the woman and family.
Because Simone, you were very conscious that your husband was hearing all of this, and yet you were perhaps not so aware. And you, Sophie, was talking about how you were obviously very worried. So thinking about how these discussions should be perhaps conducted. Perhaps that is the question.
Yeah, I mean, I wonder if, say if there is a difference of opinion, or there's an idea from, I don't know, say like if it is a doctor or a different midwife about how that woman should be, cared for if further intervention is required, for example, or something doesn't look quite right. Like, I don't know, I don't know if it's possible, but trying to have that discussion, like I said, to come to a idea together and then bringing that to the woman, so that I know that it's hard though, isn't it? Because there is that making sure that they have autonomy of care as well. I don't know. I think maybe it's just
about
language.
Your birth plan, didn't you? You talked about your birth plan where the midwife was picking up on some of your preferences. So that sort of implies that a lot of these discussions, not the sort of more urgent ones, need to really happen much sooner. Do you feel you felt your birth plan was used quite well, Sophie? Did you feel the same, Simone?
Due to the nature of how quickly my pregnancies progressed, not necessarily, but they try their best. Like, I always wanted the birthing suite for all three. I started there. Wherever I ended up may have not been there, but I feel like they always did try their best to keep to as much as the birth plan as possible. But then again, beforehand in my prenatal care, I knew that it was a plan and that anything can happen on the day. So having that knowledge as well, it kind of helps soften the blow, so to say, if you do know that you can't necessarily have what you want and they have to make slight changes. I think once you know why a change is being made, and if you know it's for the safety of yourself or your child or whatever the case may be, that helps a lot. I think it's just about keeping us informed of why certain things may not go the way that we initially thought or hoped they would go.
Yeah, I think the why is the important part there, and I think you've hit the nail on the head. Like, if these discussions need to be had and they need to be had in the room, then that's fair enough. But I think it's explaining kind of why that intervention or why that treatment might be important, giving like I guess the evidence-based kind of side of midwifery, and explaining why you're intending perhaps to go this way, rather than just hearing something like my example was the doctor just turned around and I heard all of a sudden like, oh, we might have to intervene with forceps, and there was no further explanation from that. And obviously that just made me go, oh, I thought I was doing really well, and I thought that I was really close to delivering, and all of a sudden I'm hearing this. And I think it's just being mindful of the language you use, but also explaining, and exactly as Simone said, why are these things being discussed.
And I suppose it's if you're not able to be totally part of that, did you feel that you got a good debrief afterwards? So you've had the discussion before, but when you're in the throes of labour and maybe plans are changing, what about afterwards? You know, a debrief to understand perhaps what's happened. Would you say that was done or would have helped?
It wasn't done on my end, but that was only a kind of a comment, and I heard the midwife say, in my defence, like, no, that isn't needed, like, you know.
Yes.
And then 5 minutes later my son was born, so you know, it wasn't. But you know, I think had maybe then the doctor had intervened, for example, then a debrief 100% would have been really useful, but from my circumstance it wasn't needed.
Simone, anything to add to that?
I think definitely for 2 debriefs were sort of had after, even though they tried their best to keep us, you know, informed during. I would just say your body goes through a lot actually in labour, and with my second, after my daughter was born, she came very quickly. My body went into a little bit of shock where I was shivering for a prolonged period of time, and you know, but we weren't told why that was happening. And you know, that's obviously worrying. And I'm sitting there thinking, okay, surely I should, you know, stop by now, especially having had my other daughter prior and knowing that I didn't go through anything like that. So definitely letting us know what was going on, and it not being to get to a stage where we have to say, okay, why is this happening? Because we're now so concerned. And then they're just like, oh, it will stop shortly. Your body just went into a bit of shock. But if I had said that at the time, then, you know, I probably wouldn't have been shaking so much with the anxiety on top of the fact of why am I shaking so much. So, yeah.
The debrief needs to be at the right time, but as well as communication throughout. Verena, any comments to
Yes,
share?
absolutely. There's been an interesting sort of trail in the chat box from students talking about when's the best time to introduce yourself as a student, and without any sort of comments from any of us, what's been very interesting is that people have sort of given great advice. They've also fed back that they're finding the tips very useful from both of you, and that's an excellent way. But what's happening is that people are saying, well, you know, I wait until the sort of information has been given by the midwife, and then I'll step forward and sort of introduce myself as a student, say, and then somebody else saying that when they get to 3rd year, they're really given a bit more sort of autonomy, and because of the students spending a lot of time with the woman, and they've got the opportunity to build that relationship, and emphasizing, as you were saying, Sophie and Simone, about the importance of evidence-based information, so that you understand the options, and that's about making informed choices, and that's coming from an apprentice midwife, which is great. And another lovely, there's lots of lovely examples of great care. I mean, I'll just read this one out. I stay behind in the room, explain who I am, and then I offer hot and cold drinks and anything to eat and make sure everybody's comfortable. I mean, that's lovely. It's very small, but it's one of those things that's really helpful and kind, I would say, in making people feel comfortable. And exactly, getting you noticed as a student, which is the other thing. And there's always introducing himself after the main conversations has happened, and tend to have a little bit more time with you and so on. And somebody making the point that this sort of knowing about the evidence and developing that has helped to build the confidence in decision making. And I was wondering, from your point of view, did either of you have students with you? Because we're getting a lot of interest on this from students.
particularly people who are going on their first placement soon.
Yes.
So they're really loving these tips.
Taking notes.
I think I had definitely with prenatal appointments, and it was always an ask from the midwife, are you okay with having a student midwife in here, which was good, that they actually asked your opinion and introduced first before starting the main appointment. So that was good.
Yeah, my experience with student midwife was also antenatally, not during my labour, but on my birth plan, I did say I'm happy to have students. So I guess that's a good way of seeing if that lady, is happy to have them in labour as well.
Yeah.
And that's really interesting, because what's coming out in the chat box is a sort of theme around communicating and language, but even the students gaining confidence around body language. And I wonder if you've been aware when you've been, and I suppose, Jacqui, from your point of view as an educator, it's about language in all its forms and sort of teaching that communication to students and with students when they're going through their program. So I wonder, Jacqui, if you could maybe pick up on the sort of, the body language and the communication skills that students acquire along the way.
Yes, I think we've got some really interesting points in the chat, because somebody's raised the point of having cultural sensitivities as well, and actually almost going up and above by going to the postnatal ward perhaps the next day if the lady's still there, thanking them to be part of those special moments. And I suppose what we really want, isn't it, is these really fantastic students who are obviously learning how important communication is and how they can demonstrate this communication and kindness, is that then obviously translate them into midwives. And I think it's that balance, isn't it, between the job that has to be done and all the things that a midwife does, but not leaving that communication, because that is just so important. And of course, as a midwifery educator, when you talk about physiology of birth, we talk an awful lot about how you want to make the woman feel that she's been nurtured and relaxed and not anxious, because that's going to sort of affect potentially her progress in labour. So I think it's about trying to do this within that setting, that context setting, particularly when people are busy and they're pressured and they perhaps haven't, but it is so important, as you've sort of demonstrated. That's
very interesting. Sorry, Jacqui, to interrupt. Somebody in the chat box has made the point that she's actually had a discussion with the midwife about when would be less weird to be introduced, because she was finding that the midwife she was working with, where she was placed in the introduction, didn't really fit. So the midwife's been really understanding and changed the way she was introducing both herself and the students. So I think what she said is, I guess my tip to midwives would be to allow the students the time. So I think that's a really interesting one. So we're getting tips there about this. And Simon, who's on the call from the NMC, was saying that his wife's midwife did this and they really appreciated it. So it is, as you were saying, the small things that in the context of memory and are very important. And I think it is all picking up on I did find your point, Sophie, as you've already mentioned, Jacqui, that the midwife was actually using the words that you had identified in your birth plan, the affirmative phrases and so on. And I think that's really positive, because that shows the absolute focus. And as you were saying, Simone, you said, use the phrase that you felt that the midwife was present. And that's the really key part of, that listening and taking on board what you're hearing and running with that. So it's part of the care. And it's I think about focusing, Jacqui, wouldn't you say, on
yes,
the moment.
I was reflecting actually about being present and what that actually meant. I don't know if you can recall how you actually would say that midwife was present. Was it something in the way she was or he was acting or saying? I mean, how do you show that you're present to somebody, I suppose, in your mind?
I think for me it was facing me and having a conversation, and then just letting me know, okay, I'm just going to type this up, or I'm just going to make this note, as opposed to trying to have a conversation with me, but being focused on the screen and what you're looking at, you're writing. So having that dialogue first, and then I'm just going to make a note, or I'm just going to jot this down. So having a dialogue and then sort of doing what you have to do, as opposed to doing all at once and it kind of seeming dismissive, like you're just another number that I've got to get through.
So it's sort of like a narrative, isn't it? I'm going to do this now, and I'm going to do this, so that you really sort of, you accept as to why they've got to leave the room or why they've got to make that note, but you just sort of don't feel ignored, but they're actually talking through what they're doing. Yes, that's interesting. Would you feel the same, Sophie? Anything?
Yeah, definitely. And also I could tell when she was in the room that she was kind of present there for me, because she would notice things. Like I remember at one stage, as I was progressing, I was like anticipating the next contraction, so I wasn't kind of enjoying the rest in between. And so straight, she picked up on that really quickly and said, actually, I can see that you're waiting for the next one to come. Enjoy the rest and focus on the breathing when the contraction comes. And just that made me feel like she was aware of what was going on and was really focusing on my care at that point in time. And attending to any needs, really. Like if we, at points when I needed water or I needed, a bit of food or something, she was able to grab that and was literally present there for us. So
anticipating, was she anticipating a bit?
Yeah, definitely. Yeah, I know. I remember at a point when I think I was kind of transitioning to kind of the pushing stage, and I didn't know I was at that point, and she said to me, oh, at some point soon you might start to feel like you need to push, and that's okay, go with that. So she definitely anticipated kind of how I was progressing and reassured me that if I felt like that, it was normal and it was okay, rather than reacting once I get to that point, me going, what's going on, in her then saying, oh, it's because you're in that stage now, so definitely kind of being proactive rather than reactive.
I suppose it's fair to say that some women don't want to have that dialogue, and that dialogue might have to happen with their birthing partner, because they tend to be very much focused, particularly if they're hypnobirthing or whatever. But it's finding that out, isn't it, how that conversation is going to play out and who needs to know, but not but just sort of recognizing that importance of knowing what's going on and who's going to communicate that with you.
I think somebody's made another good point, which sort of picks up, Simone, you answered my previous point about body language, because by the midwife telling you that and being not being sort of trying to talk and type at the same time, and listening to you and then saying what she was going to do, that sort of was an indicator through body language and as well as language that she was listening to you and focusing. But somebody's made the point in the chat box, which I think is really interesting, which picks up on your positive affirmation sort of language. Sophie was saying that some people have words that they really don't want you to use, and that's nearly as important, because they don't want you to say pain or contractions, but would prefer you to talk about discomfort, intensity, waves, and so on. And that's again coming back to the communication and knowing what language is appropriate for the person that you're looking after, and from your point of view, making sure that whoever's caring for you knows what your particular preferences are with relation to language. And I mean that can also apply to all sorts of things, from musical choices to, as you say, what sort of ambience you want in the room. during your labour and birth and so on. So,
and Verena, I must share with Sophie and Simone what Katie has said. She said it's nice to hear positive stories regarding midwifery care. It's easy to get lost in negative media. However, I believe all of us students and midwives on here really do care about women and are keen to change negative experiences. So I think, you know, I'm hoping that you've really boosted morale this evening, Ashley.
Yes. Yes.
Yeah, no, I agree with that. I think you guys do an amazing job in difficult circumstances. You know, I'm sure you all want more staff, but you know, I can't fault the care that I had at any stage of my pregnancy, and the second time around so far, it's been incredible. And just touching on that point that what somebody made, I think making sure that it's patient-centered and specific to that patient or that lady. You know, you mentioned about words, and I guess reflecting on their birth plan, like I specifically said in my birth plan, please don't mention pain medication unless I ask for it, and that was followed. That was never mentioned. You know, it never once was asked, oh, it looks like you're, you know, struggling a little bit, would you like anything? Whereas some people want that straight away, and it's just remembering that we're all unique and we all have different preferences, and one lady in one room might be asking for everything, and one lady in another room might want a completely kind of hands-off approach, and just remembering that everyone's different, you know, and we're not all going to want the same things.
Yes,
and Hannah's got some fantastic.
Yes,
Hannah's got some fantastic tips for the students on the call, because she said that she finds it a lot easier when she was on community because you actually know the women that you're caring for. But what she said is always try and give anything a go at any given opportunity. Trust in yourself, ask lots of questions, and just watch how the midwife you work with approaches each woman and family she cares for. Women love honesty and someone they can feel they can trust and be able to feel in control of their care and what they want. So nice messages for everybody else on the call. Sorry, Verena, you were going to say something.
It was just picking up on that one, and then the following comment is around communicating clearly without using medical terms or jargon, and being, you know, and all this stuff about accurate, clear records and so on, and you know, being timely and appropriate with care. And somebody's made a you know, tiny point, but you know, noticing that somebody was sort of inadvertently clock watching while they were in labour, and taking the clock down because you don't want to be reminded necessarily that, you know, another minute has passed. So I think that she noticed that I was looking at the clock, so they took it down for me. Noticing things is so important, makes such a difference mentally, and that's a lovely sort of image, I think. So and then there's quite a lot of good advice about eye contact and taking in all the information and letting people, you know, finish what they're saying and then relaying it back to make sure that you're understanding what's been said, and what's in it, what's the question, I suppose, that's within that sort of discussion. So I think that shows a lot of understanding of the nuances of language, both in the antenatal community birthing period. So there's lots of terrific sort of things, and everybody's making the point really, in essence, that it's about providing tailored care for every individual to meet their needs, and that's going back to the preferences and listening and so on. So that's all very, very positive and encouraging, and great to hear it from your perspective about what made a difference. And I think there's all sorts of interesting points in the chat box, and
so it's amazing how quickly an hour is almost gone.
Yes. I'm just scrolling down to see if I've missed
final
anything.
Thoughts on this, based on what you've heard from the people on the call and their comments, and anything that else you wanted to add here?
Was that question to us?
Yeah, Simone. Yeah. Shall I start with Simone this time?
It's just, I feel like it's a great career. You're, really helping women and start a new chapter of their lives. So it is a very important job that's being done, and I just feel like having that one-to-one communication and care with women, as long as that comes through and they feel like they're being listened to, and as much as possible their wishes are being met, and if not, explaining to them why it can't be met, women will be happy. They'll be happy with their care and their journey.
Mm. Mm. Thank you. Sophie, did you have any?
Yeah, I think it's also remembering like the important job that you guys have, because I guess when it's your bread and butter and you do it every day, I guess sometimes you forget the important, or not necessarily everybody does, but it's just reminding actually what an amazing role you guys play. Because even though it was 2 years ago since my last birth, I can remember everything so clearly, like so many points, and I can really remember the really positive few sentences that midwife said to me, the way that they made me feel, and the care that I received, and kind of trying to always just remember that lady at that point in time, it's such a huge pinnacle moment in her life, and you're playing such an amazing role in that, and I appreciate there are lots of other external pressures to being able to provide the kind of full care that necessarily you'd want to do, but just always remembering the really amazing role that you guys do, and that we appreciate it.
That's lovely.
Well,
And there's a couple of lovely ones in the chat box, which I'll just read to you because I know you probably can't see it. Simone and Sophie, I'm just glad that everything Sophie and Simone have said I currently do as a student, so that made me feel more confident myself, knowing that what I do is valued. And thank you very much for sharing your experiences. I feel it's great to hear from Sophie and Simone. It's confirmed that little things that I do are appreciated and noticed, and making the point that providing emotional support is equally important as physical support for women. And I'm now a second-year student midwife. I cried when I passed my first year, as I'm one step closer to achieving my dream. Tips for first years: I have confidence to ask questions, enjoy it. It's hard work, but amazing. And the feeling you get when you finish your shift is beautiful. And then thank you, Sophie and Simone, for generously sharing your invaluable insights. The wealth of experience provided is instrumental in our journey to becoming great midwives. So I think we can certainly say that this has been appreciated, and your insights and telling us about your experiences has been really, really valuable. Thank you.
And Louise says, congratulations, Sophie, and hope you have another amazing experience with your journey. So
thank you. I hope so too.
So thank you both. I know this is a busy time for mums in terms of getting children sorted at this time. So very much appreciated that you've actually spent the time with us this evening, and importantly shared your stories, which of course we want people to visit the website, because you can then read and you can listen to Sophie and Simone's story in full. And also by visiting the website, you can learn more about our partnership working campaign. And importantly, particularly for the midwives on the call, but for students who would also find it useful, the reflective aid, which sort of guides you under some various headings to actually particularly do a reflection on partnership. So do check out the website at www.nmc.org.uk/partnership, and hopefully you'll find those resources useful. So I think there isn't any more particular comments coming through on the chat other than thank yous. And probably just leaves me to say have a good evening, and do keep an eye out for any of our future webinars.
It's goodbye from all of us, and thank you for joining us.
Yeah.
Thank you.
Bye.